Hello my dear student, Assalamu alaikum. Hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor at the Women's Medical College in the Department of Anatomy. You are welcoming again in the third session on bone presentation. As you know, in our body, all the bones are not the same. They are different in their size, shape and other morphological features. According to their functions and their organizations and the locations, different kinds of bone are present in our body. Now, today's topic will be the morphological classifications of bone, as well as we will discuss about the other classification of bone. Now, in the morphological classification, what we actually understand is that what are the structure and what are the morphological features of individual bones. Now, this morphological feature includes the size of the bone, the shape of the bone, the different features that we can see through our naked eyes. Now, in this classification, we will see that what are the types of the bone according to their shape. In the morphological classification of the bone, we can divide the bone into different types. The first type could be the long bone. You know that some of the bones are elongated. They are long. They have ends and the shaft. Another type could be short bone. They are short in morphological features. Then it could be flat bone, like it is having a flat surface. Another type of bone could be the pneumatic bone. That means the bones which are having air cavity inside them. At the same time, there could be a sesamoid bone which has different type of developmental background. Also, some of the bone can have different kind of organization which is not that much particular. That type of bones are called the irregular bone. Now, in this slide, we can see the classification of the bones on the basis of morphology. 6 types of bones on the morphological features. Number 1, long bone. Number 2, short bone. Number 3, flat bone. Number 4, irregular bone. Number 5, pneumatic bone. And number 6, sesamoid bone. Now, let us discuss the morphological features of this individual bone. In this picture, we can see some of the bones which are morphologically classified. For example, this is a humerus which is present at our arm, which is very much elongated, having ends. This is termed as long bone. This is a bone of the skull called parietal bone, which looks very much flat. So, it's a flat bone. Now, some of the bone present at the nasal area, like this, like the ethmoid bone, which is having some of the air cavity inside them. So, it is pneumatized bone or the pneumatic bone. This is a vertebra which is very much irregular in shape, and this is irregular bone. This is the patella which is present at the knee, and this is sesamoid bone. And some of the bones which is present at our hand, they are short and they are carpal bones. Let us start with the long bone. You know the long bone should be long. Now, this long bone are classified again into 3 departments. One bone is called typical long bone. These are the typical long bones which are having some typical features, like they are large in size, 2 ends and the shaft in between. Also, these bones are having 2 epiphyses and 1 diaphysis. Remember, the typical bones are having 2 ends and they are having 2 epiphyses, and the shaft which is actually the diaphysis. The examples are femur, humerus, radius, ulna, tibia, fibula, so on. Now, another type of bone is called the miniature long bone. This is very interesting. It is called miniature just because it is mini in shape and size. That means it is smaller, but it looks like a long bone. Now, what is the main difference? The main difference is miniature long bones are having 1 epiphysis and 1 diaphysis. They are not like the typical long bone who are having 2 epiphyses. Now, in the miniature long bone, these bones are basically present at our extremities, commonly at our extreme end of our extremities, like the metacarpal bone, metatarsal bone and the phalanges. In this picture, we can see the typical long bone like a femur having 2 ends, humerus, 2 ends and the shaft in between. Now, in the miniature long bone, these are the metacarpal bones and these are the phalanges. These miniature long bones are actually having one epiphysis at the distal end. These are the distal end, as we can see. The thing is that in the first metacarpal bone, the epiphysis, that one epiphysis is present proximally, which is called the aberrant epiphysis that we have already discussed in our previous classes. Now, modified long bone. This is a special variety of the long bone. What is the peculiarities of modified long bone? Sometimes it is also known as atypical long bone. Remember, modified long bones are having some special properties. Like, this is the first bone to be ossified. It is having two primary ossification center and one secondary ossification center. At the same time, they are having intramembranous ossification. Most of the typical long bone are having intracartilaginous ossification, but in case of modified long bone, it is having intramembranous ossification. Sometimes it is present very much subcutaneous. You know, most of the typical long bone are covered by the muscles, ligament, fascia, everything. But this type of modified long bones are easily traced underlying the skin. It is also horizontally placed. Most of the typical long bones are vertically placed, but the modified long bone is commonly present horizontally. And lastly, it doesn't have any medullary cavity. Most of the long bone is having a medullary cavity inside the shaft containing the yellow bone marrow. But in case of modified long bone, it doesn't have any medullary cavity. Sometimes this type of modified long bone can be pierced by subcutaneous nerve. Most commonest example of the modified long bone is clavicle. Let's see a picture of a clavicle. We can see this is a clavicle. As you have completed your superior extremity, so you can see it is having medial end and the lateral end and the shaft in between. The shaft is very much curved. At the medial 2/3 it is convex forward and the lateral 1/3 it is concave forward. It is present at the upper part of your thoracic cage. Now let's start the short bone. These bones are short. They are cuboidal in shape. They are having 6 surfaces. Now, as it is having 6 surfaces, so 4 surfaces are articular. That means those surfaces are articulating with the other bones. At the same time, the 2 surfaces which are not articular, they are providing attachment for the muscles, ligaments and the other soft tissues. And sometimes those surfaces provides the passage of the blood vessels. These type of bones are actually intracartilaginous. So this type of ossifications are commonly present in the carpal and the tarsal bones. That means all these type of bones are actually developed after birth, except few tarsal bones which are appearing before birth, like talus, calcaneum and the cuboid. Now, this is a picture where we can see these are the carpal bones who are the short bone. We can see over here which are leveled, that is scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate and hamate. These are the bones which are short bone. In this picture, we can see these are the tarsal bones. These tarsal bones are also short bone. We can see the talus, calcaneum, navicular, cuboid and 3 cuneiforms. Now let's start the flat bone. Remember, the flat bones are flat. Why they are flat? Because they are having 2 surfaces. And interestingly, those 2 surfaces are made up of compact bone. In between these 2 plates of compact bone, there will be a spongy bone, which is also named as diploe. Now, these spongy bones are having red bone marrow inside them, which is persistent for the rest of the human life. And the main function of the red bone marrow, as we know, they are producing blood cells. Now, these are the flat bones which are very much present in the most important area of our body. For example, in case of skull, it is protecting the brain. In case of thoracic case, the flat bones which are the sternum and the ribs, it is protecting the heart and the lungs. Now, in this picture, we can see some of the flat bones. which is present in the skull, like parietal bones over here, frontal, squamous part of the temporal bone, and the occipital bones. And another flat bone is present at our jaw, which is the mandible. The other bones are having other features. In this picture, we can see the flat bones of the thoracic cage. This is the sternum, which is the most important anterior boundary of the thoracic cage, an elongated bone having manubrium, body of the sternum, and the xiphoid process. And also, these are the ribs, 12 ribs on each side. These are also flat bones. Now, irregular bone. Irregular bone itself says that it is irregular in shape. That means it doesn't have any particular shape. They are irregular. Now, these irregular bones are having some properties, like they are having intramembranous ossification and they are covered by a thin layer of compact bone. At the same time, inside them there will be a spongy bone. Most commonest example of the irregular bones are vertebra, hip bone, and some of the bones that we have seen in the base of the skull. Let's see some picture. In this picture, we can see this is the vertebra having the body, pedicle, transverse process, articular process, superior inferior, and the spinous process. So it doesn't have any particular shape. Again, this is the hip bone along with the sacrum. We can see this is the ilium, this is the pubis, this is the ischium, this is the ischiopubic rami, this is the acetabulum. It is also an irregular bone. Now, pneumatic bone. Interestingly, pneumatic bones are called pneumatic just because these bones are having air cavity inside them. Interestingly, these air cavities are lined by the mucosa, which is just like the respiratory epithelium. That means pseudo-stratified ciliated columnar epithelium. Now, why these air cavities are present? This type of air cavities are present in those bones where the lightening of the bone is very important. Also, they are having the humidity maintenance property. That means they can condition the air. Also, they are having the properties to maintain the resonance of voice. So, three things again: it makes the bone lighter, it helps for the resonance of voice, and it helps for the air conditioning. Now, these air cavities or air spaces are called air sinuses, and if the inflammation happens in these air sinuses, that is called the sinusitis. Most commonest example: maxilla, sphenoid bone, ethmoid bone, and sometimes frontal bone. Now, in this picture, we can see this is the picture of a maxilla, and this is the maxillary hiatus that represents the opening of the maxillary air sinus. This is sphenoid bone. It is also having air cavity inside it. That is called the sphenoidal air sinus. Over here it is present inside the body. Now, lastly, another type of bone is called the sesamoid bone. Sesamoid means seed-like, so they are very smaller in size. The sesamoid bones are commonly developed within the tendon of the muscles. That means it is formed by the friction, continuous friction of the tendons on the bone surface. Like the patella. You know, the patella is one of the largest sesamoid bone in our body. Patella is formed by the friction of the tendon of the quadriceps femoris muscle. At the same time, they are having some special properties, like as they are developed due to the friction of the tendons, that's why they are not having any periosteum. They doesn't have any Haversian system. They are not having any sorts of blood supply. So how they are living? They are living by the process of diffusion. Also, they doesn't have any nerve supply. Usually they act as a pulley for the movement of the muscle. Now, some of the examples of the sesamoid bone. Patella is the commonest example of the sesamoid bones that is developed in the quadriceps femoris. Also, pisiform, which is present as a carpal bone in our hand, it is developed at the flexor carpi ulnaris. Fibula is another type of sesamoid bone which is developed at the lateral head of the gastrocnemius, that is a cuff muscle. Rider's bone, which is present as a tendinous origin of the adductor longus. One bone that is cuboidal in shape, it is present in the peroneus longus. And the type of bone, they are actually two in numbers. they are present at the first metatarsal under the flexor hallucis brevis. So these are the examples of the sesamoid bone. Now in this picture we can see the typical sesamoid bone, which is the patella, present at the knee, and also the pisiform bone, which is present at our hand as the carpal bone. Now that was all about the morphological features of the bone. Now we will start another type of classification on the basis of the architecture. Remember, some of the bones are very much compact and some of the bones are spongy. The compact bones are also known as dense bone and the cortical bone. Why they are compact? Because they are having very much organized Haversian system inside them. Now these type of bones are usually present at the shaft of the long bone, and also they are having a established kind of blood supply. Now this is the very important thing, is that compact bones are very much strong. On the other hand, the spongy bones, which is also known as cancellous bone or the clavicular bone, they doesn't have any established Haversian system. They are very much porous and spongy, and that's why within this pore there are accommodation of the red blood cells or the red bone marrow. At the same time, these are commonly present at the ends of the long bone. In this picture we can see the compact bone, which is present at the shaft, and at the end there is the spongy bones having profuse amount of red bone marrow, which are producing blood cells. Now another type of classification is present on the basis of organization of the matrix. There are oven bone and lamellar bone. Oven bones are the primary bone or the immature bone, which was present at the very beginning of human life. These type of bones are having collagen fibers, but they are not well organized or they are very much irregularly placed. Osteocytes are more over here. On the other hand, the laminar bone, which is the mature bone, which is commonly present in the adult life, they are actually having very well organized collagen fibers. And over there, the Haversian system is also very much organized. Now, another type of classification depends on the axis, or they are classified on the basis of their arrangement, where they are actually present. There are some bones which are axial bones, and there are some bones which are appendicular bones. The axial bones are present at the midline of our body, like the skull bone, sternum, ribs, everything, the vertebra obviously. On the other hand, another type of bones which are present at our extremities, they are called the appendicular bones, like the humerus, femur, tibia, fibula, and other bones. Also the bones which are joining the extremities at the trunk, like the pelvic girdle and the shoulder girdle. So that is all about for today's presentation. Today we have discussed the different type of bones and their classifications. Hopefully in the coming days we will start the blood supply of the bone. Thank you very much for your patient hearing. Stay safe.